Hi everybody, and welcome to this revision video on sleep disorders as part of the psychological health and wellbeing topic for Stage 2 psychology. Let's get started. So in this course, we talk about three main sleep disorders because they are the most commonly reported with the highest diagnosis rates. There are more sleep disorders. There's actually several hundred sleep disorders according to the diagnostic criteria. But as part of this course, we focus on three. And then we also talk a little bit about what's called parasomnias, which aren't technically disorders, but can affect a person's sleep quality and quantity. But more on that later. So the three main sleep disorders that we talk about in this course are insomnia, sleep apnea, and narcolepsy. So starting with insomnia, it is characterized as a sleep disorder which causes a reduction in the quality and amount of sleep, making sufferers unable to function at their optimal level. So this isn't a matter of someone deliberately choosing not to get the required amount of hours sleep. This is an inability to either fall asleep or stay asleep or both. So a person with insomnia will try and get the correct amount of hours sleep, but something is obviously stopping that process from happening, and it's a consistent problem. So it's not just a bad night's sleep now and then, it is a chronic sleep disorder characterized by sleep debt and sleep deprivation on an ongoing basis that is not by choice. So symptoms of insomnia include daytime fatigue, impaired concentration, irritability, and very drastic mood swings, which probably is no surprise given what we have gone through already in this course. So some people most commonly suffer from insomnia that involves not being able to fall asleep at night. So that's the most common type. So they take several hours to fall asleep at all. Once they're asleep, they're fine, but they obviously just don't have enough hours because it's taken them too long to get to sleep. Whereas other sufferers of insomnia will have no trouble falling asleep. It's waking up consistently that's the problem. So they'll stay asleep, or they won't be able to stay asleep throughout the night, I should say. So they'll wake up every few minutes or every hour or two, rather than having a good solid sleep and sleeping throughout the night as they should. There are some people who wake up very early in the morning and then can't go back to sleep. That's also quite common. So waking up at 2 or 3 in the morning, so coming out of a sleep cycle and then unable to then continue on with a new one, depending on how many hours of sleep that they need. So there's different versions of insomnia, but they're all characterized by, reduced quality and amount of sleep. So either trouble falling asleep, staying asleep, or both. So some insomnia sufferers have a combination of the above, which is awful. So that would be very severe chronic insomnia. Now, sleep apnea is also a very common sleep disorder in which a person stops breathing periodically for a few moments while they are asleep. So this can occur hundreds of times per night. The mild form of this is snoring, whereas the very severe form of sleep apnea is cessation or stopping, in other words, of breathing. So obviously we need to breathe in order to survive as human beings. So if the brain recognizes that, the brain and body is not getting enough oxygen, a natural defense mechanism is to arouse the body, so wake the body up, to restore breathing. So a typical case of sleep apnea is someone will snore very, very loudly and severely and then all of a sudden stop. All right. And obviously that's them stopping breathing and then have one very big giant breath or one very big giant snore and then resume snoring. So sleep apnea is quite serious. It is most common in overweight men around 40 years old. However, it can affect other people, such as those who have an underdeveloped jaw or a receding jaw is also quite common, and also people who smoke. So it is more characteristic of people who are also obese. Most obese people have mild or severe sleep apnea of some form because obviously the weight is putting pressure on their throat and their breathing, and it leads to snoring and them stopping breathing several times per night. So there are several treatments for sleep apnea. Some of them are relatively minor and then some of them are a little bit more advanced, as we can see here. So there are oral mouth guards to keep the airways open that can be bought at pharmacies that are pictured here. They're not very popular because they are quite uncomfortable and they take a bit of getting used to, but it ensures that the mouth is kept open. So obviously the airway can always have free flow of oxygen. There's also what we call CPAP machines, so continuous positive airway pressure machine. So essentially that's an oxygen mask that's worn during sleep. often on the mouth and the nose or just on the nose. This is the most common therapy that is prescribed, or the main treatment for sleep apnea that is prescribed. As you can see here, here's a picture of one. They can be quite expensive, so they can range between $1,000 to $3,000, depending on obviously the brand and how advanced it is. But a CPAP machine can allow a person to have a constant flow of energy, a constant flow of oxygen, I should say, and so they won't need to be awoken because they stop breathing. So it will allow a person to go through the natural stages of sleep and the correct amount of sleep cycles so they can get their restorative sleep without having to be woken up constantly to resume breathing. In extreme cases of sleep apnea, surgery may be needed to correct the jaw placement of the upper and or lower jaw. So if someone has a very severe receding jawline, as we can see here, that will block the airway when they're on their back and cause them to stop breathing. So often a surgical procedure is the best recommended treatment. So where they will have surgery to bring the jaw forward by a few millimeters, or top or bottom jaw, depending on how severe it is. And this will obviously allow more room for breathing to occur during sleep. Other strategies to combat sleep apnea include losing weight, so being in a healthy weight range, quitting smoking, and avoiding depressants such as alcohol and drowsy medication before bed. Now, narcolepsy is a sleep disorder that is also quite dangerous. It is a sleep disorder in which people experience irresistible and uncontrollable and also unpredictable daytime, what are called sleep attacks of sleepiness, lasting 5 to 30 minutes. So the term attacks is starting to become rejected in a lot of other readings and a lot of other sources and so on. So unpredictable daytime sleepiness, all right, the attacks is not really used in a lot of media anymore, but according to the DSM-5, that's the terminology that still exists. So in the new version of the DSM-6, I believe they're going to be taking the term attacks out. So just unpredictable daytime sleepiness, where people enter sleep stages lasting 5 to 30 minutes. For some people, it might only be a couple of seconds, but very severe cases of narcolepsy that we will see, or we have seen, can last for several minutes. So sufferers can also experience a loss in muscle tension, which adds to sleepiness, called cataplexy. So there are certain instances of narcolepsy where cataplexy is also present, where someone will collapse to the ground or collapse in their chair. Or there are other cases of narcolepsy where cataplexy is not present. So they will remain standing or remain sitting upright, but will enter sleep mode in an unpredictable way. So these sleep attacks, or this insatiable sleepiness, most frequently occurs when a sufferer is in a heightened state of arousal, such as laughing or when they're very angry. And what's unique about narcolepsy is the sufferer will go straight into REM sleep. So it'll bypass the other sleep stages and go straight to REM. Now, this can be very, very dangerous, as these attacks can occur, or this insatiable sleepiness can occur at work or whilst driving. So a lot of narcoleptic people cannot drive, or they're not allowed to drive, or they're very limited to what they can do in terms of work if it's very, very severe. The cause of narcolepsy is not 100% known. There is evidence to suggest that it may be genetic. It can also be brought on by a severe head injury. We do know, however, that the problem is in the hypothalamus of the brain. So there's some issue with the suprachiasmatic nucleus and the hypothalamus not functioning properly. And obviously there's a biological overwhelming need to go straight into REM sleep, which obviously is not characteristic of a typical sleep cycle. Then we have what's called parasomnias. These are technically not sleep disorders unless they negatively impact functioning, but I'll talk about that a little bit more later. So parasomnias include a range of sleep phenomena known as things that most people go through, especially in childhood. So include a range of sleep phenomena, including sleepwalking, sleep talking, nightmares, and night terrors. Now, usually these are nothing to worry about. However, if they start to present themselves in adulthood especially, and it starts to negatively affect functioning, or it negatively affects others, then it may be considered a sleep disorder. But in general, parasomnias are nothing to worry about. Parasomnias are very, very common in children due to the more hours of sleep that they typically get and that they typically need. So For example, it's far more common for a child to sleepwalk, sleep talk, have nightmares, and have night terrors. We tend to grow out of these as we get older, but of course, like I said, there are exceptions where adults can experience parasomnias due to illness or very high periods of stress, or obviously if it's genetic. What's interesting is that night terrors and sleepwalking occur during slow wave sleep. So that's often why when people are in the midst of a night terror, which is sitting up, bolt upright, screaming or running around as if they're in a terrified state, they don't recall this at all the next day. They're actually told that this has happened. This is also the case with sleepwalkers. So they will often wake up in random places of their house with no recollection of how and why they got there. Because it occurs in slow wave sleep, the brain waves are too slow to remember waking up or too slow to register what's actually going on. Whereas sleep talking and nightmares occur during REM sleep, which is our dreaming sleep, which again is quite common. Most of us sleep talk whether we realize it or not, and we all have had nightmares or will have nightmares as we get older. Hopefully not very often, but typically it happens during REM sleep. So like I said before, these typically reduce with age, however, can reoccur in adults following periods of stress or illness or injury. So those are the main sleep disorders and parasomnias as part of this topic. I hope you found that interesting and useful. As always, any questions, let me know.